Hello, Facebook. How is everybody this afternoon? Well, I hope. Kind of a chilly day out there. We are all waiting for a few warmer temperatures. Heat's off here at City Hall because, you know, we have that old boiler system, so we're all kind of in our coats a little bit today. Let me begin by talking again a little bit about some of the numbers here. Sorry, where are they? Right here. Here we go. I'm sorry, too many pieces of paper. City of St. Louis now has 1,549 cases. St. Louis County has 4,022. State of Missouri has a little over 10,142. On the good news front here, there are fewer people in the ICU and fewer people on ventilators, and that is a very good indicator, of course, of how ill people are. Only 94 people, this is yesterday's number, on ventilators. So we are continuing to see, and the St. Louis Metropolitan Pandemic Task Force has put out these charts. We are continuing to see hospital admissions be down. I'll show you this. Just, I don't know how well that comes through, but you can certainly get to this on the St. Louis Metropolitan Pandemic Task Force Facebook account. 3 o'clock this afternoon, there'll actually be some new numbers for that. So we continue to see a downward trend. The trend in hospital admissions has been trending down. It's been down, this is a 7-day rolling average, trending down for about the last 2 weeks. And so we are mildly pleased with that, I think is the way you would say it. Of course, you don't want anybody to be sick, but we are embarking on a time frame where we are going to have to learn how to coexist with COVID-19, and that's what we're all working on each day. You know that on Monday evening, today's Wednesday, I haven't really talked a lot about this. On Monday evening, around 6 o'clock, we released the standards and the guidance for in each industry sector. Let me get this book here. So I had it printed out just because it's easier as a reference document, but all of these are online. Anybody who hasn't seen these standards yet, please go online, just go right on the city's webpage. It's right on the home page, and what you will see are guidelines for reopening offices, for reopening commercial office buildings, for reopening hotels. Hotels have been open, but additional standards for hotels, for manufacturing, for retail, for restaurant, for personal services, and for transportation. So this was developed by an intense process by the working groups that were made up of members of each industry, as well as the doctors from the St. Louis Pandemic Task Force, Dr. Eccles, who heads our health department here in the city of St. Louis, and St. Louis County. So we came together on these standards, which are 99.9% the same in St. Louis City and County, which I think is a real plus for the people that we're all trying to serve, which are our residents and our businesses, so that everybody can understand what the expectations are about opening, easing the door open, cracking the door open on Monday the 18th. We do know that many businesses will remain closed then, even businesses that are allowed to open. Many of them are not going to be opening on Monday. They may feel they may just want to wait and see how this goes and open a few days later or a week later. There's no requirement for any business to open on Monday. There is many requirements that if you do open, you have to follow the standards, which will enable the 6-foot distancing, enable, have your employees wear masks, encourage your customers to wear masks. Reaching for my mask, I've been wearing this one today. This is just a cloth mask, which is easy to wear. And so that's happening on Monday, but business owners get to make that decision themselves. The other thing that I would say here is that it's really important that we all wear masks. If you're going to be outside and it's unpredictable as to whether or not you might be able to stay 6 feet away from another person, then really you should be wearing a mask. So I hope that you will all encourage folks to do that. One of the things that we are rolling out tomorrow morning is sort of a starter pack of PPE, which is masks and gloves for, oh, here it is, I've got a sample here. A starter pack for small businesses, so businesses with 10 employees or less. We think most people, most businesses, large businesses, we know they have been able to buy masks, buy gloves, buy the things that they need. But a business that might have 1 employee, 1 to 10 employees, may not have masks yet. So this is just a little starter package. It's got some instructions here that talk about, wear a mask in public, avoid touching your eyes and nose, practice social distancing, wash your hands with soap and water for 20 seconds. And what it provides here, it's probably hard to see, but 20 gloves and 20 face masks, surgical face masks. And it's just a starter kit for small businesses who may want it. To register to get a starter kit, all you have to do is email restart St. Louis, RESTART STLOUIS at stlouis-mo.gov. There are 3 distribution sites that open tomorrow morning at 10 o'clock. One on North Kings Highway, 1408 North Kings Highway. We've got the addresses here. One at 3115 South Grand, and then one at 1520 Market, which is a city building right here in the center. So one north, one south, one right in the center. Businesses can go there tomorrow between 10 and 2 at the north and the south site, and between 9 and 4 at 1520 Market. That's a city building. So folks can go there to pick these up. You do need to register because we need to be sure that we can account for what we gave out. So please register. It's very simple. Doesn't require any private information, just the name of your business, your name, your email, phone number, no social security numbers, no federal ID numbers, nothing like that. But we do need to know who we're giving them out to. So please register, go online and register. And we're going to give those out for the next couple of days, Thursday and Friday. So that's a start on businesses. Are we ready with questions yet?
We do have a couple of questions,
Okay.
Mayor. Emily's watching and wants to know, is there going to be additional guidance for hosting summer camps?
So, child care facilities, as you may know if you've read this, if you've taken a look at this guidance here, are able to open if they follow the CDC guidelines. The CDC guidelines are very good under the heading of child care. Now, summer camps is something that we're working on right now with various people in that business, as well as our school partners and our child care partners who we have regular conversations with. The city's recreation centers are not going to have recreation programs this summer because we just do not feel that we can run those programs and socially distance young people. Our pools are going to be closed this summer, unfortunately. And as I said on Monday, I think it was, I hope I get to change my mind on that, but right now that looks unlikely. There's still a lot of COVID out in the community. There's still a lot of virus. Everybody still needs to be careful. And a pool deck with, people running and playing and that kind of thing, a lot of touching is just not a place that the doctors think is a good idea to open for this summer.
A question, Mayor, from, oh, sorry, were you
No,
done?
that's good.
Okay.
I'm done.
A question, Mayor, from Bridget, who's asking about a date that we anticipate for gyms to be able to reopen. And she also follows up and asks, is it possible that gyms could send the city an example of what they can do to help reopen when they're able?
Yeah, Bridget, thank you. That's something that I said on Monday, because we had a number of questions from both people who want to go to their gym and people who operate gyms. We are in conversations now with some of the gym community, and it's being headed up by our group that's worked on all of these standards. Please do send us what you think those standards should be. We know that gyms are places where people are breathing hard, just, spreading possible germs, where they're sweating, where there's a lot of equipment. So that's why gyms are not open, not able to open right now. I just think it's, the doctors really just think it's not time to do that. But certainly we want your input, so please do send it to Restart St. Louis. And send us what you have. Certainly we'll take it into account and look at it in terms of when gyms might be able to open and under what conditions. And I know there's a lot of, I did a Facebook Live this morning with the business community for about an hour and a half. And there were a lot of questions about gyms and a lot of people who think, well, I'm not really a gym, I'm really something else. Like I'm really a yoga studio, or I'm really a Pilates, or I just have a small gym. So those are some distinctions that we're trying to work out right now.
On the topic of pools and summer rec, Dennis is watching and wants to know if the city will consider opening athletic courts such as like tennis courts.
So what the new order says, Dennis, is that parks will stay open, playgrounds will stay closed, and contact sports, those courts will remain closed. So tennis is not generally a contact sport. We have not made the decision yet as to whether or not we're going to open our city tennis courts. That's something that we're going to work on here in the next couple of weeks. But we have not prohibited other tennis courts from being open because it's not a contact sport. But soccer is a contact sport. Handball is a contact sport. Basketball is a contact sport. And those courts will remain closed in the city.
A question from Public Radio, Mayor. There are multiple parts to it, though.
Okay.
First, how
Public
many...
radio is always going to have a multi-part question.
But they're pretty
Thank
good.
you, Public Radio.
But they're good questions. How many phases, so we can repeat, how many phases of reopening are there?
There's only one right now. There will be more, and I know you want to know, will there be 2 or 3 or 4 or 5? And we don't know the answer to that because we just don't have the health data to say that yet.
What are the parameters of each phase, including which businesses can open and how large the gatherings can be?
Mm-hmm.
And the standards for moving into the next phases.
Mm-hmm. We are continuing to work on all of those subjects. We've just come off of trying to figure out who can open in phase 1, but we will be continuing to watch what happens with number of cases, yes, but we expect we're going to get a big increase in the number of cases because we finally have more tests. We don't have as many as we'd like, but we have more tests. So we're watching that. We're watching the percentage of positive tests based on how many are given, and we're watching hospitalizations. So all of those things will be taken into account before we go to phase 2, or we may be doing this just a little bit at a time. It might not be literally a phase 2. It might be, okay, now such and such can open, and we base that decision based on what their operating procedures will be or they've committed to, and based on what we're seeing in the data. So I understand that you want to know the answers to all those questions, but we just don't know them yet. We have to take a go slow approach here and see what happens. And it's not just what happens right here in the city of St. Louis, but what is happening in St. Louis County, what's happening in St. Charles, Franklin, Jefferson counties, what's happening in Illinois, because we're all a region and we're a very mobile region. So I understand your questions. We don't have the answers to those yet.
Can you reiterate for Kristen, who's watching, where the public can view the hospitalization data that you shared at the beginning?
Yes. Did we post it on?
I don't know if we posted today's.
The best place to go is the Facebook page for the St. Louis Metropolitan Pandemic Task Force. Long name. St. Louis Metropolitan Pandemic Task Force. They post there every single day. And that's where these charts came from, these from yesterday. So that's the best place to go see those. And most days, not every day, but most days, Dr. Garza, who's the incident commander for the St. Louis Metropolitan Pandemic Task Force, most days he also gives a verbal update as to where things are.
A question about how many people have been tested in the city so far and how that compares to when our stay-at-home order went into place in March.
I don't know the answer. I don't know those numbers. When the stay-at-home order went into place in March, there had been very few people tested. Today we're testing more and more, and that's a number that I can get for you. I will tell you that about a week ago, that number was that there had been about 8,000 people tested in the city of St. Louis, but that number is a week old, and so that's a number that I will try to get for you. We actually have to get it from the state, believe it or not. We get it from the state because there are so many people now doing testing. All these federally qualified health centers, Quest, LabCorp, the hospitals. Do you have it there?
I have for the state 124.
Yeah, we know the state number, 124,000 as of yesterday had been tested. But what I would really like to know here, and I don't think it's, well, let's see, cases, that's case count. Let's see.
That's the percentage of positive cases.
For the whole state.
Mm-hmm.
Yeah. For the whole state, the percentage of positive cases is, well, it's so low here. Last time I looked, it's around 5% of the people tested. That's just the people that have had tests. And I know that what you want to know, and frankly what I want to know, is what is it county by county? And unless they've posted it recently, Kyle's going to look for it right now. I don't think we have that data.
Two people are asking about when will the DMV and City Hall open, because there are a couple of folks looking to renew their license plates.
Mm-hmm. It's going to be sometime in June. We are not opening City Hall to visitors on the 18th. We are going to be bringing some workers back on the 18th, and we're looking at about 2 weeks later. This is not an announcement. I'm just trying to tell you what we're thinking here while we continue to look at the data, but perhaps early June.
A question, and I don't think we're doing this, but why are we allowing malls to open? I don't think we have any malls, but I don't know what the county's doing.
For good or for bad, there are no malls in the city of St. Louis. So that isn't one of those questions that we have to answer. I do believe that St. Louis County is allowing malls to open. That's what it says in the reopening standards and guidance here. So it has to, stores still have a lot of protocols that they have to do with regard to testing their employees, with regard to 6-foot distancing, with regard to putting plexi or some barrier between the customer and the person where you're paying, the pay counter. So there are a lot of those things that have to happen under the new standards. But the city doesn't actually have any malls, as in any enclosed malls.
Chris's question, Mayor, is what do you tell employees who just do not feel safe about going back to work on May 18th?
City employees, all
It
employees?
says employees.
Employees. I think to some extent you have to make that decision yourself. If you have an underlying medical condition and you don't, you're not comfortable going back to work to possibly be exposed to more people, I understand that. Maybe your employer will change your job duties so that you no longer interfacing with the public. So I think that I understand that. I mean, we've had a number of people in the city of St. Louis who have retired. They're able to retire, and they said, now would be a good time. They don't want to come back to work. That's a trouble for a difficult for delivering services, but it's certainly a point of view that I can understand for some folks, depending upon their health conditions.
A couple of parents, I think, are asking about whether or not a decision has been made regarding schools come fall.
There's no decision regarding whether or not schools will open this fall. Will Pinkney is the individual in my office who's the Director of Children, Youth, and Families. He is on, I think it's twice weekly phone calls with the school, not just St. Louis Public Schools, certainly they're on the call, but also the charter schools, also the parochial schools, private schools, all really talking about that. It's the 13th of May. Most schools would not have even been out by now, or if it was now, it'd be just, coming up. And so, 3 months from now is a long time. We've been in this pandemic now for not quite 2 months in the St. Louis region. And 3 months until school starts is a long ways. And I know that schools are struggling with that decision, and most of them are waiting to see what happens in the next month or two before they decide that. As a parent, that is very tough on you, I know. And frankly, most parents that I've talked to, my kids are not school age anymore, but most parents that I've talked to their kids are ready to go back to school too. This was fun for a little while. It was like a little extended snow days, but now they're missing their friends, and even doing work from home is a challenge. We all know that.
Carrie is asking, Mayor, if we eventually, or have we seen the 14-day downturn in cases that we previously talked about?
We have, and we're looking at it as 7-day rolling averages. We've seen that for a couple of weeks since the peak, which was on the 25th of April. The reason we look at it sort of the 7-day rolling averages is that sometimes case counts, maybe a lab doesn't report their cases for a couple of days too. So we're looking at that on a 7-day rolling average. That's what the St. Louis Metropolitan Pandemic Task Force, Dr. Eccles, and the county's health department continue to look at.
A follow-up question to the PPE about small businesses. Will the city also be providing PPE to low-income individuals who may not have access to hand sanitizer, gloves, and or masks?
Yeah, thank you for that question. So it was just last Friday that we, the city of St. Louis, got a big shipment of masks that we had on order for weeks and weeks. And so we are now working with the Housing Authority. We are working with the folks who distribute Meals on Wheels. We're working with senior buildings for senior age people, working with all those buildings to help distribute a couple of masks to each individual. We're doing some packaging right now because we know that especially some of the senior buildings, they can't get out and get masks. The other thing that's happening is our health director, Dr. Eccles, is working directly with nursing homes, assisted living facilities. He's been to many of them to make sure that they have the PPE that they need and to make sure that they understand about infection control and how to run their business in such a way that they can tamp down the spread of COVID.
What is the goal of expanding testing and testing more people?
The goal of testing more people is to identify who's positive, quarantine or isolate, I think is really the word if you're positive, isolate the person who is positive, find out who he or she has been in contact with. In other words, contact tracing, you keep hearing that word, and quarantine those people. So you isolate the positive individual, you quarantine the folks that are asymptomatic, have not tested positive, but they've had a significant exposure, meaning within 6 feet for more than 10 minutes. Quarantine those folks to see whether or not they develop the COVID symptoms and therefore need testing. So the point is to identify folks, to isolate them. When you isolate and quarantine, then you stop the spread. If we didn't do that, which is of course we didn't have them in the beginning of this, then folks that are walking around with it and don't know it, there's nothing, they're not intending to do this, but then they are spreading the virus without knowing it. So that's the point of testing more people.
A couple of questions regarding bars and restaurants and the kinds of establishments that will begin to softly reopen on May 18th, including places that have buffet style and then bars that don't have food.
Buffet style's out. And again, go to our website. If you're really interested in restaurants, please, it's not that many pages, I don't know, it's 5 or 6 pages of, what to do with your employees. I'm gonna pull it out since we're talking about this. Put my glasses on here. So restaurant operating procedures. First of all, you've got the 4 main things. Practice social distancing, monitor your employee health, use protective equipment, clean, sanitize, disinfect. Those are the 4 big picture things. And then it goes into how to help a restaurant do those things. In other words, restaurant responsibilities to their staff. Goes through taking temperatures, wearing masks, make sure to give your staff training on cleaning. There's a whole number of things. The second thing, staff arrival and departure. How do you do staff arrival and departure when you're getting ready, when you're opening your restaurant? Screen folks, temperature check, ask them questions, what to do if someone answers yes or has a temperature. They go home. That one's simple. They go home, but they contact their medical professional. Then restaurant preparation, interior and outside, what bleach solution to use, hand washing stations in high traffic areas. Then there's a lot of those. Limit group size of tables. Make sure that if you have booths, for example, that there's a plexiglass or other solid material up at least 5 feet high between booths. Cleaning and sanitizing, protective equipment, there's a whole lot of things here. So those are the kinds of things that restaurants have to be able to do to open on the 18th.
Tracy's question, Mayor, is how bad is the budget and how long will it take us to economically recover?
The budget is bad, Tracy. It's really bad. It's over, from March when this started through next year, which next fiscal year, it's maybe $120 million bad, meaning we won't have that revenue. We don't know the answer because none of us know what's going to happen. Pardon?
What was that number again?
120 million. Yeah. Give or take. None of us know how many people are going to go back to work, how many businesses are going to go open, how many people are going to go back to work and therefore pay earnings tax, how many people are going to go dine out or go shopping and therefore pay sales tax. We just don't know that yet. And until we reopen and we begin seeing whether or not we can reopen, and I'll tell you what, it is going to be very dependent on how many people will wear masks. Because for people who won't, and I know there are unmaskers, I call them, or non-maskers, I say steer clear, because a mask is, being distant is the best, but the second level here is wearing a mask. So how long will it be until we recover? You know, it took years before we recovered from the last downturn. If you remember the foreclosure crisis 10 years ago, it took years to recover from that, and I expect it'll take a good while to recover from this.
So you have a lot of people watching who don't think it's a good idea to softly reopen on May 18th. So I don't know how you want to collectively address
Okay.
folks who just think it's a bad idea and that we're not ready for May 18th.
I think that's a really valid point of view, number one. And I think there's a couple of things. One, businesses don't need to reopen on May 18th. They can. But you also don't need to go. If you don't think that's a good decision to reopen, then make sure that you won't want to patronize those businesses, shop at those stores, or eat at those restaurants. If you work at one of those businesses that is reopening and you don't want to go back to work, you're afraid to go back to work, or you're concerned about going back to work, then I think you've got to work that out with your employer. If you have underlying health conditions and you don't want to go back to work, then, you know, in all likelihood, and I'm going to direct you to, the webpage went down here, let me find it again. I'm going to direct you to the Missouri Department of Labor, and I just hung up from a phone call about an hour ago, maybe an hour and a half ago, with Anna, what's her last name? Anna Way, who is the head of the Missouri Department of Labor, trying to talk through different scenarios about unemployment, because I know that unemployment, the state's unemployment, along with the pandemic unemployment, the $600, is in the neighborhood of, it's over $900 a week for most people. And I know that there are people who just would prefer not to go back to work at this time, because their unemployment is sort of keeping them alive. I wouldn't ever say that somebody's doing well on unemployment, and they're just afraid of the risk. So there are a lot of rules about unemployment, but for most people, if you go online, and it's simple, it's let me look here. By the way, they also have a Twitter account. Their Twitter account is @MoLabor. Most of you are on social media, that's why you're here. And they have a chat function as well on their website, so you can ask them specific questions. But for most people, you will not have to go back to work, at least immediately, if there's a good reason that you don't want to go back to work. Underlying health condition, age, that sort of thing.
An interesting question from Dean. On that note, do you happen to know if a doctor's note, if someone had like an underlying condition, a pre-existing condition, if a doctor's note carries any weight for not having to go to work, or if that would help?
I'm sure that the Missouri Department of Labor, and of course this is not a decision made by the city, I know that you all know that, but yeah, they're going to take everything into account here. And that's what Anna Way really said on the phone when I spoke with her earlier today. There are a lot of nuances to this. Get online, do your homework here on the Missouri Department of Labor website. And you know, right now the federal unemployment, pandemic unemployment, only goes through July 22nd, I think it is. Excuse me. So get online and take a look at that.
Two final questions that we have time for today. One, what is the policy going to be for city workers when the city begins to slowly reopen, I suppose?
The policy about coming back to work, or about not coming back to work, or, I mean,
The question was policy for city workers who don't want to come back to work.
well,
Maybe this is a city worker.
so it probably is. So I think it depends on what the circumstance is, honestly. It depends on underlying health conditions, whether or not you might be able to do a job where you don't interface with the public. So I think it really depends. You're appointing authority, and I don't know what department that you work in, but we want to work with all of our employees because we want you to come back to work, and because we need employees to serve our residents. And I think, some city employees have been off for a while, and they have been paid. We can't do that indefinitely, of course. So that's something that we've got to work out. Maybe there's sick time, maybe you have vacation time. I don't know what the exact situation is.
Final question we have time for is, how is the city planning to enforce on May 18th that everybody is following the new guidelines and standards?
So everybody following the new guidelines and standards is always difficult. It's not like we have an inspector in every business or on every corner. So employees have regularly called us about their employers, because there's still been a lot of businesses open, as you know, grocery stores, hardware stores, those businesses. And we regularly hear from employees who think that an employer is not doing the right thing. And we investigate that, and we work with the employer to bring them into compliance. And that's what we'll do in this case as well. I recommend first that you talk to your employer and say, hey, I don't have a mask, or I can't stay 6 feet apart, or, it's always best to first, I think, talk with your employer. And then if that isn't working for you, then call 657-1499, which is the health department number, or call or go online and put in a complaint to CSB. CSB is 622-4800, or it's at STLCSB, or it's online on our website where you can upload pictures. That's often very helpful if you're willing to do that, go to that trouble. More helpful, frankly, than just a voice message, because it's hard to relay exactly what you're talking about just with words. So I encourage you to do that, and we will follow up on them.
Okay, let's do one more question.
Okay.
From Richard, any idea where we will be on numbers that can attend wedding receptions in July at our downtown hotels? That combines a lot of things.
So right now, ballrooms, banquet rooms, meeting rooms in hotels are closed. They remain closed, and it will be a few weeks. I'm just going to say a few weeks because I don't know the exact date before those rooms are able to open. And when they are able to open, they're going to have a much more limited capacity, because in order to, you really can't have a round table. If you think of a normal wedding reception, you can't have a round table with 8 or 10 people sitting around it and have that be social distancing. So there'll be a lot of changes even when they are able to open. So middle of July, I can't answer that. That's 60 days away from now. But it will depend upon the size of the room and how many people can be socially distanced. I think things like dancing are probably hard to socially distance and dance. I think standing around in big groups, pretty tough. This COVID thing is real, and it's dangerous, and we are trying to not encourage situations where someone might be positive in that room, and there are plenty of positive people out there, that they don't spread it to other people. And you think about a wedding reception, usually you've got little kids there, and you've got grandma and grandpa, and maybe great grandma and grandpa, and you sure don't want them to get exposed either. I have a friend who's getting married in early June. This is a daughter of a friend of mine, and they have decided to go ahead with their wedding, small group, just family, 10 people or less, outdoors, and they're going to have a big reception in a year or whenever they can. So everybody, it's tough. It is hard to miss those things, like all the kids right now that are graduating from, elementary school, high school, college, who don't get to have their graduation ceremonies. It's hard. It's hard to miss these really milestone events that we all have in our lives. But, we're in the middle of a worldwide pandemic. So
Is that it?
that's it. Thank you all. Appreciate everybody. Don't forget to thank all the workers that have been out there working all along: police, fire, EMS, dispatchers, trash truck drivers, healthcare workers, doctors, nurses, folks who work in housekeeping, folks who work in the kitchen, of course, grocery store clerks. We've all been going to the grocery store. I hope you're only going once a week and you're not making it a social outing. You're taking just yourself and your list. And I hope you're all wearing a mask. Wear a mask. Think of this when you wear your mask. Say to yourself, who am I wearing a mask for? So when I wear a mask, I'm wearing a mask for myself because I don't want to get sick. But I'm also wearing a mask for anybody who I'm around. So that's my family, maybe neighbors, my coworkers. That's the reason to wear a mask. It's not much trouble for you. It's kind of, I'm going to put mine on right now. It's kind of, a little bit, doesn't look that great. I look kind of like a bandit right now. But it's not that much trouble for you. And if you can keep yourself from getting sick, or keep someone that you care about, or your coworkers, etc., from getting sick, it's worth it to wear your mask. So please wear a mask. Thank you all.